Hi, in this video I'm going to show you how to document a bedside ultrasound in MedConnect. Before you do this, you want to make sure that you've hit End Study or End Exam button on your bedside ultrasound machine so that the images transfer into the patient's chart wirelessly. In order to get into the correct chart, however, you want to make sure that you've inputted the patient's name and MRN correctly into the patient information section. So once you've done that, you're going to go to Ad Hoc here. Navigate to ED Clinicians, ED Procedures, and click Chart. Your name will default here as the procedure list, but if this is a resident, and you'll need to list your supervising physician here. And this needs to be someone that's on the credentialed supervising physician list that's found on this website as well. So I'll select myself. And then you'll select this radio button that the supervising physician was present if you have a supervising physician there and you're a resident. The procedure was done in the emergency department, so we'll check that off here. And then the rest of the fields we can leave blank because they're not really relevant to bedside ultrasound. Then we can navigate down to the procedure performed and select bedside ultrasound. The first question here asks if this was an educational or non-billed study, meaning that the patient will not be billed for this and it was not used in the medical decision making for the patient and not documented elsewhere in your note. So if that's the case, then you'll have to fill in who your supervising provider was or what the confirmatory study was. So you can always choose a radiology study, or for instance, if you're doing a renal scan, you can have a CT abdomen pelvis as the confirmatory study. In most cases, however, for attending physicians that are doing this as part of the medical care for the patient, you'll select no because this is being used for medical decision making. Then you'll navigate to what type of exam you completed, and the lists are all here, or other if it's not included for some reason. And pelvic, I'll say, and then we did it for vaginal bleeding and pregnancy, and to discuss this with the patient. When you select your exam, it will highlight what interpretation is needed down here. So navigate down to the yellow section. And also we did a transabdominal ultrasound. We saw a single intrauterine pregnancy with no free fluid and no adnexal mass. And then there's a space for other findings. So I'll write fetal heart rate 150. And then to get out of this, we will click the green check to sign it. And then just like any other procedure, it will be visible in your documentation here. So we have our procedure note here. And then it will go into our note. If we refresh it or we haven't made our note yet, it will automatically go into the procedure section. And then if you need to look up the patient's images for reference following the ending the study, you can find that in Image Viewer here.